Good morning, guys. I hope we're all sparkly. Do you know what? The journey to feeling sparkly is not always plain sailing. Disappointingly, obviously when you present with low testosterone and the multitude of symptoms, low energy, low libido, brain fog, troublesome fatigue, erectile dysfunction, you want to get better. That's a given. That's why you've presented to the Men's Health Clinic. However, it isn't as simple as here's your pill, job done. There is a titration process. Now what happens? You obviously still have your endogenous natural testosterone production, albeit substandard because you've got low testosterone, but it is keeping you level. Now you start testosterone replacement therapy and you start HCG. That has a short half-life, about 2.1 days. So it takes about 11 days for that to stabilize. Now that means hopefully you will see a qualitative improvement in your sense of well-being within the first 2 weeks. Disappointingly, sometimes it can be anxiety. Now you've not had stimulation of your neuroendocrine system if you are secondary due to low LH. And HCG mimics luteinizing hormone. So you can see why a spike of HCG stroke LH may cause a spike of your neuroendocrine hormones. And one of those symptoms might be anxiety. It is unfortunately a rite of passage. Once you are stable, hopefully those negative symptoms should resolve and you should feel stable. Now let's consider testosterone. Now this has a longer half-life and is majorly influenced by SHBG. So the exogenous testosterone gets absorbed, it goes into the capillaries or the lymphatic system, goes into your veins and goes to the liver to be cleaved to release the testosterone. That testosterone gets bound to SHBG and albumin. And only around 2% of that testosterone is free to be used as testosterone, converted to DHT and converted to estrogen. Now again, by the very nature of injecting a drug, you are going to cause a peak and a trough. This is basic pharmacokinetics. Now, physiological changes can elicit a psychological response. Now we know that is clearly demonstrated by the female menstrual cycle. So what do you do? Well, as I've just said, it's a bit of a rite of passage. One thing you really need to understand is it's only temporary. So once your drug levels are stable, your prescribing clinician should be making changes if necessary, because sometimes, obviously, we hit the nail on the head with the first go. People feel great. Nothing changes. They crack on with life. And I think that's the premise behind testosterone replacement therapy. It is getting on with life, looking after your stress, sleeping well, eating right and training right. But it isn't always an easy journey. What can sometimes happen? Well, again, you can have negative psychological consequences of hormonal fluctuations. So not only the HCG, but also the testosterone. As your testosterone spikes, you have a spike of dopamine. As your testosterone lowers, your dopamine lowers. So pleasure to no pleasure. So that is obviously good and bad. What else can happen? Well, you can get a spike of estradiol. Now, as we know, the aromatase enzyme is located in numerous tissues. And there are two tissues within the body that you can directly impact how much testosterone gets converted to estrogen, and that's liver health and body fat. So if you are a bit of a chunky monkey, your ride can be a little bit troublesome. Now we do need to know how your body responds to the testosterone before making changes, because otherwise we are chasing our tails. Alan Watts, muddy waters are best left still. It's super important to appreciate that. Now, we don't want to be reactive, we want to be proactive. But the journey to hormone optimization isn't always plain sailing. Now, we should be making incremental improvements every time we adjust your protocol. Again, if we need to. You should be concentrating on lowering your propensity to aromatization and trusting the process, because compliance is a major issue. If you are not doing your injections as per recommendations, you will not feel the benefits as soon as you can feel the benefits. Because if you don't feel well, the obvious answer is, I don't want to do it because it's not making me feel well. And I fully appreciate that. However, it is administering a drug to achieve stable levels, and pharmacokinetics and pharmacodynamics dictate that there will be a titration process, and it isn't always plain sailing. However, working with us, we should be always aiming to make improvements. I can only do what I can do, and that's adjust your protocol. The rest is really up to you. So it is making those improvements to your lifestyle, your diet, and your training, and understanding the process. Now, there is some autonomy involved in this, because we cannot support you to the nth degree, and it actually doesn't do you any good, because this paternalistic relationship that we've had with patients as doctors hasn't led to an improvement in overall health. Now, we want to concentrate on prevention, not cure. However, everybody allows things to get bad before they make the decision to change. It's a peculiar trait of human nature. We only react when there is a time when we are struggling, and that is disappointing. So we know that we should be maintaining a good, healthy diet, training, and lifestyle. And what do we do in times of trouble? Disappointingly, we chase the path of least resistance. We often comfort eat, we often engage in bad behaviors, self-destructive behaviors. And who does that help? Nobody. Then you have self-pity. Who's to blame? Yes, you. However, what are you going to do about it? What are you going to do about it? Because ultimately, it is up to you. There is only so much I can do to help you on your journey. The rest is really up to you. It is simply a matter of perspective, and simply a matter of understanding that if you are going through hard times, those hard times are temporary. There is always going to be light at the end of the tunnel. Remember that. That is an incredibly important point to make. No matter how dark the place is, how low you feel, it is your decision, your perspective that will make the difference between you swallowing in the darkness or fighting for the light. The darkness is very easy. The light takes effort. What do you need to do? Earn your reward.